Can you imagine? Most people only discover they have kidney disease when their kidneys are already failing. And even more surprisingly, the incidence of kidney disease is increasing among young people. Today, we'll talk about kidney health, the warning signs to watch out for, and how you can protect your kidneys. Kidney health simply means the kidneys are working properly. The kidneys are vital organs which perform important functions to keep the body healthy. These functions include: the kidneys remove toxic waste substance from the body through the production of urine. The kidneys also regulate the amount of salt and water in the body. So when you drink a lot of water, you urinate more. But when you are dehydrated, the kidneys try to conserve water by decreasing the frequency of urination. The kidneys also regulate the acid-base balance of your blood. They therefore prevent your blood from being too acidic or too alkaline. Finally, the kidneys also produce important hormones. They produce erythropoietin for red blood cell production, renin, which helps regulate blood pressure, and calciferol for strong bones. Kidney disease occurs when there is damage to the kidneys, and therefore they are no longer able to perform their normal functions. There are two main types of kidney disease. There is acute kidney injury, which occurs suddenly and may develop within days to weeks. They are often reversible if treated early. There is also chronic kidney disease, which develops gradually over months to years. This may lead to permanent damage to the kidneys. In Ghana, chronic kidney disease affects about 13 to 15% of adults, with hypertension, diabetes mellitus, and glomerulonephritis being the main causes. Most patients present late with advanced disease. Acute kidney injury is also common in hospitals and is often due to severe infections like malaria, sepsis, dehydration, and drug toxicity.
Yes, so now let's talk about some causes of poor kidney health. Kidney diseases can happen for different reasons, and the causes are usually grouped into three main categories: pre-renal, intrinsic renal, and post-renal. Now let's talk about the pre-renal. So pre-renal causes happen when the kidney does not get enough blood flow. Kidneys need blood constantly to filter out waste and remove toxins. If the blood flow drops too much, the kidney cannot function properly. And when kidney cannot function properly, that means the kidney cells begin to be damaged. And when it happens in this way, the kidney function reduces. This can happen when there is severe dehydration, either from vomiting, diarrhea, or not drinking enough water. It can also happen when the body loses a lot of blood or fluids after an accident or an infection. And even sometimes when the person has an underlying medical condition like heart failure or heart conditions, there is the failure of the heart to pump enough blood to the kidneys. So that can also cause the kidney problems. Now let's talk about the intrinsic renal causes. The intrinsic renal causes occur when there is a damage within the kidney. So the damage starts within the kidney themselves, affecting the glomeruli, the tubules, blood vessels inside the kidney, which would have filtered the blood. And this reduces the ability of blood to be filtered by the kidney, remove waste from the blood, and also it causes imbalance of fluids. When this happens, it can also contribute to renal damages. Most of this is seen in people with diabetic kidney diseases, where there is too much blood sugar over time in the blood, which tends to destroy the kidney filters. And sometimes, like I mentioned earlier with the pre-renal state, people having heart failure conditions. In this case too, people having uncontrolled hypertension, it can also destroy the kidney slowly and gradually. By the time that you realize the blood vessels have been destroyed that supply the kidney. So because the blood supply to the kidney is shut, the kidney then begins to also undergo destruction. Kidney inflammation, mostly called the glomerulonephritis, can happen after an infection like strep infection. Infection from suburinary causes can also contribute to renal damage if these bacterial infections are not well treated. It is also good to know that the excessive use of medications, including painkillers like ibuprofen, diclofenac, NSAID, any drug at all, can also contribute to the destruction of the kidney filters, which are also called the renal filters. The toxic use of some unregulated herbal mixtures contain substances that can also harm the kidney cells. Now, it's more often than not that people sell all sorts of medications which are herbal drugs, and they tend to say that one medication which is a herbal drug is able to do a lot of stuff. Yes, people are doing well with their work, bringing verified and good herbal products, but now it's more abused. So whenever you're taking a herbal medication, it's encouraged that you validate the source of the person who made the herbal drug. Now let's talk about the post-renal causes. The post-renal causes, if you check the trend, the pre-renal causes was with the blood supply. The intrinsic was within the kidney itself. Now the post-renal causes, they happen after the kidney's function of filtering blood is done. So that means the kidney has been able to filter the blood, remove the toxin. But the problem here is the kidney, which has now filtered the blood, and then the filtered blood, which is urine, cannot flow out of the kidney, and it causes a backup or a backflow of the filtered substance, and it gets back to the kidney. This pressure damages the kidney over time because it can't flow. Pressure builds up, and then the backflow damages the kidney over time. Some examples that we do see most like this, when there's kidney stones, and then we say kidney stones are solid crystals that block the urinary tract and sometimes the ureter itself. The enlarged prostate can also contribute to obstruction, and most of the time the post-renal causes are from obstruction. So the kidney stones and enlarged prostate, in case of males, enlarged prostate can also be an example. And also there can be tumors in the urinary tract, although it is rare, but it can happen. And when it happens, it prevents the urine, which is the filtered part of the blood, from leaving the kidneys. So now let's talk about some risk factors for kidney diseases. Some risk factors that increases the risk of a person developing kidney disease divided into modifiable and non-modifiable risk factors. When we talk about the modifiable risk factors, that means an effort of us can help prevent the disease, and a non-modifiable aspect is, although we may not have a strong control over it, but genetical predisposition may play a role in that. So yes, the modifiable risk factors include high blood pressure which has not been controlled, diabetes, obesity, smoking, excessive salt intake, frequent use of painkillers, and less water intake. These are the modifiable risk factors that contribute to poor kidney health. And like we mentioned, all these are those we can control. Now let's take an example. Taking painkillers regularly for headaches or for body pains or whatever reason without medical advice can damage the kidney. So because you had a headache, that's very true that perhaps you had a stressful day, but sometimes sleep, that's a non-pharmacological aspect, could be a factor. Not always do we have to use the medication. Should you want to use the medication, that is why health practitioners are there, registered clinicians are there. Talk to them and let's stop the self-medication, because at the long run, the kidneys are those that suffer the challenges. So we should always remember that the non-modifiable risk factors are those that we cannot change, we cannot control, and they include age, family history of kidney diseases, genetic conditions like polycystic kidney diseases. These are non-modifiable. So right now, if you don't control the modifiable and then you are still predisposed by the non-modifiable, it makes your risk highly greater of getting a kidney disease. So let's talk about some early warning signs of poor kidney health. So one challenge with kidney disease is that it may not show symptoms early. Okay, yes. However, some of the warning signs may include changes in urination, either more or less frequent, foamy or dark, or even bloody urine. Sometimes there will be swelling around your body parts, for example, your ankles, your face, around your eyes, and even your feet become swollen. Sometimes there will be abdominal pain, which will be discomfort in the sides of the lower back. So this side, the left and right flanks, there may be pains over there. Not just that after eating that your it means that no, but consistently, if you've been feeling those, it's best to see the clinician, go to the hospital, talk to the doctor. And sometimes too, it comes with fatigue, weakness, and dizziness. Remember we mentioned that as part of the causes of the poor kidney health, heart could be in the embryo, right? Where we mentioned that when there is heart failure, when the blood from the heart is insufficient due to poor heart pump, it can contribute to kidney disease. Therefore, because the blood from the heart is low, it can also come with weakness, fatigue, and dizziness. There can also be loss of appetite as a sign of poor kidney health. There will be nausea and vomiting. And in cases with people having uncontrolled hypertension, there is persistent high blood pressures. And when you have all these challenges, it's best to see the doctor. It's best to visit the hospital for clinical consultation and advice. So now, as young people, as youth, as teenagers, how can we protect our kidneys? Because in our youthful days, we are exposed to a whole lot of things we call fun. How can we protect them? The good news is, kidney diseases can be prevented. If you follow carefully what we just discussed right now, we gave the modifiable and non-modifiable. And I must be honest with you, in cases that the non-modifiable are causing much harm, it's very low. But in cases where the modifiable risks are causing much harm, is very high. That means if you're able to control and modify these risks, we are on the safer side. That is the great news. So what can we do? Let's drink enough water to keep the kidneys healthy and flush out waste, because when there is low blood volume as a result of hypovolemia, that can cause a reduced supply to the kidney. Less filtration, then you get a kidney health problem. And also, reduce salt intake. And I must be honest with you, reducing salt intake saves you for life. Do you know why? It protects your heart from getting uncontrolled hypertension. It also saves you from getting a poor kidney health. So you are using just a stone, a single stone, to kill two birds. You save your health by having a healthy heart and also a healthy kidney. Again, you should avoid the misuse of painkillers. Don't take painkillers mostly without prescription. Is it not that you have it in your locker, your drawer, your bag? So whenever you feel like, I'm having a migraine, I'm having a day, you self-prescribe and medicate yourself. Get to talk to the doctor and avoid the misuse of drugs. And also prevent and treat UTIs or STIs. So all urinary tract infections, UTIs, must be treated. All sexually transmitted infections, STIs, must also be treated, because most of these are caused by bacteria. And from our discussion so far, by the bacteria, when they come into the system, they tend to cause much destruction that you can expect. And these destructions can also tend to affect the kidney health, and the life you want to enjoy becomes shortened, because malfunctioning kidneys reduce life expectancy, also reduce life enjoyment. And also be cautious with herbal medication. Just as stated, we shouldn't just be following the train of buying herbal medications because a friend recommended that this herbal drug is able to do this, that, so you go for it. And then it's our kidney that goes to be affected. Most especially to my meals there, it's okay we try to ginger ourselves and become the men as we want in the bed. But I will encourage you that it's not all these aphrodisiacs that is going to help your sexual performance, that will also help your kidney health. You may have this temporary sexual performance of achieving a long time in bed, but at the long run, what about your kidney? Imagine having a malfunctioning kidney where the sexual health now no more becomes of benefit to you. Should you want to do anything, talk to your doctor. Don't just be using combinations for sexual enhancement. You are going to affect the kidney. Also, let's maintain healthy lifestyle. At least exercise. Yes, of late we have this life of saying that the big people don't exercise. So if you have some small money there, then you just be having the luxury life, sedentary life. That's very nice. Life is good by God's grace. But you shouldn't forsake your health. So even if possible, a 30-minute walk a day, a jog a day, will put your life a better step ahead than the person who has a sedentary life with a genetically modified and predisposed pattern, and also the modifier risk factor, that person has a longer risk of getting challenged. But with the exercise, it reduces this risk and saves you for better time. And also have regular checkups for hypertension, kidney function, cholesterol level. The simple thing is regularly visit the hospital. So yes, today we reason empowerment on kidney health. Remember, a healthy kidney is a healthy life, and a poor kidney health is a poor life. Life in the sense that you have a life, but it's not really enjoyable. We are leaving you with this message as Tina Health Initiative to be able to take control of your health. Health comes first and never underestimate it. Your kidneys are essential for your overall health. By making healthy choices today, you can prevent kidney diseases tomorrow or in the future. Remember, prevention is always better than treatment.